We're going to push ahead, folks. Our next talk will be delivered by Dr. John Morris. Dr. Morris is the Harvey A. endorsed May Friedman Distinguished Professor of Neurology here at Washington University. He's also the director of the Charles F. Knight and Joanne Knight Alzheimer's Disease Research Center. He's going to talk to us about residual capacity, and then he's going to hand off the presentation to Dr. Mark Rakel. Dr. Rakel is a professor of radiology, neurology, neurobiology, and biomedical engineering at Washington University. Drs. Morris and Rakel will be giving a talk entitled Creativity in Dementia, Unmasking Latent Abilities.
Thanks very much. Do I need a microphone? No? Okay. So I have, I've been at lots of Alzheimer-themed conferences, but wow, having religion and affairs and baths and dogs all together, it's been kind of unique for me, so I appreciate it. I appreciate the invitation to be here. As Jeff said, I'm going to give sort of a set the stage presentation, and then show a video of some individuals with more advanced Alzheimer's disease dementia that will bridge into the presentation that Mark Rakel is going to give. Mark, for those who don't know, is a preeminent neuroscientist and uses imaging modalities to understand how the brain functions or does not function, and he will be able to give us his perspective with a particular insight about how creativity emerged in one of his family members when she had progressive dementia. So to begin, I'll just let everyone know, whoops, did I do the wrong thing?
Yes.
Oh, right there. Okay. Just to let you know that all of our research at the Alzheimer's Disease Research Center at Washington University is funded almost exclusively by the National Institute on Aging. This is our group, about 120 individuals, and an immensely talented team. Very honored to be the director of the Knight ADRC. And I thought I would just give, as I said, set the stage of where we are now in Alzheimer's disease research. In some respects, it's the best of times. Formal Alzheimer's disease research in the United States began really in 1984, so we're almost 30 years in, and I think all of us involved would say that this is the most exciting time because of the advances that have happened in research. We now are able to understand the underlying pathology of the disease in the brain, not only understand it, but be able to detect it in living people. We always had the idea that we never really knew if someone who had dementia had Alzheimer's disease until we looked at the brain under the microscope after the person died, an autopsy. But now we can see those same changes we look for at autopsy in people during life. So we have the ability to detect the disease in people during life, even before they reach the stage at which people develop symptoms. That is, in people who are perfectly normal but on the road to becoming demented, we can detect it pre-symptomatically. And we have many therapeutic agents that are developed to address those brain changes, the mechanisms that cause those brain changes that at least theoretically have the potential to halt the disease process. So the greatest time ever, and then we couple it with really the worst of times, and the worst of times is all of those drugs that we have such high hopes for have all failed. None of them has shown benefit, at least to date. And second, this is a very difficult time in biomedical research in general, but certainly in Alzheimer's disease in particular, because of the constraints of funding made worse by the debate about whether we're going to have a budget and whether there will be budgetary increases and sequestration it's become a very, very difficult time. So we have the greatest chance really to translate all that we've learned in 30 years potentially into truly effective therapies, but we're halted because we really don't have the funds to be able to do that. I just show here since the millennium, since the year 2000, these different drugs, about 11 or 12, that have all gone to the final phase of testing to see if they would benefit people with Alzheimer's disease, dementia, and none of them have. It's been very discouraging. We think we have one idea why they may have failed, and it may not be that the drugs are the culprit. It may be the time in which we chose to intervene. It may be too late for some of these drugs. We may have to go much earlier in the disease course. But it's been very discouraging and has a ripple effect on the pharmaceutical industry because these trials cost billions of dollars, and they're just the scientists are all at the pharmaceutical companies are all very interested in pursuing this, but the lawyers and the finance people don't want to continue to invest in something that doesn't yield some success. Now here is in 2011 what the allocations were at the National Institutes of Health. That's the prime funding source for biomedical research in the United States, and it is very dependent. It's entirely dependent on what the Congress appropriates for the research budget. The president can, like all budget items, say that I'd like X amount of dollars to go or this amount of increase to go this year, but we're dependent upon Congress. And at the NIH, you might be able to see that about $6 billion in 2011 went to cancer research, about $4 billion to cardiovascular disease, and about $3 billion to HIV/AIDS, less than $500 million to Alzheimer's disease. Even though we are in the grips of a coming epidemic as people continue to age, particularly the baby boomers. So this is going to really, in the next decade or so, become overwhelming for our healthcare system. But relative to these other terrible diseases, there are many terrible diseases, Alzheimer's disease is woefully underfunded. And hence, we get what we pay for all those other major killers, cancer, stroke, heart disease, HIV/AIDS. Because we've invested in research, we're beginning to see success. The proportion of people now who die of those diseases is decreasing. The only one of the major killers that is increasing in death is Alzheimer's disease, in part because we don't give it the funding we need to translate what we think we've known into research. Most people don't realize that Alzheimer's disease kills in the United States more than people with prostate cancer or breast cancer combined. It's a major, major killer. Well, I thought I would just show you something about the stages of Alzheimer's disease. Just like all individuals are very different from other individuals, all patients with Alzheimer's disease are very different than all other patients with Alzheimer's disease, so no one has exactly this course. But the disease begins very insidiously. We can't tell when a person has changed from their cognitively healthy state into the very initial stages. It's only looking back that we can get an estimate of that. The whole course of the disease lasts somewhere on average 7 to 10 years. Some people die sooner than that. Some people live longer than that. But everyone who has Alzheimer's disease dies. It's a universally fatal illness. So in that very early stage, as I say, it's very difficult to tell. But when the disease progresses into the mild stage, then family can tell that the person is impaired. The person generally, not 100%, but generally the person lacks insight. So very few people call me up and say, I'd like to come in and get an evaluation for my Alzheimer's disease dementia. They don't appreciate that they have it. It's the family that calls. And when I'm asking the person, well, tell me about your memory, any problems? No. They don't get it. But the family will know, because the salient feature in Alzheimer's disease dementia is a person has declined in his or her cognitive abilities, memory and thinking abilities, compared to what he once attained. They know what he was like a few years ago, and they see the decline. In this mild stage, people are still often out in the community doing shopping, driving automobiles, going to work sometimes, but they're not doing it at the level they once did. There are changes. But to a casual observer, seeing them in the community, you might not think there's a problem. They look and act normal. And at home, for basic activities, dressing, grooming, bathing, toileting, they're independent. They don't need help. So there's a change in that mild stage. Family can recognize it, patient probably doesn't, and casual observers probably wouldn't recognize it either. In the moderate stage, it's probably apparent to everyone. And these people now are not able to do things in the community by themselves. They may go out, but always in the company of others, family members typically. And even at home, for those basic activities, the dressing, the bathing, the grooming, they may still be doing it, or aspects of it, but they need supervision. Otherwise, if they're dressing, they may tend to wear the same clothes that they've worn day after day. Someone has to watch them. It's dirty. Got to change. Or they may put on 2 blouses instead of 1, or get things inside out. So someone has to be there. And they might have to be reminded to bathe, or reminded to brush their teeth. They can do it, but they need supervision. In this moderate stage also, not everyone is affected by this, but this is when troublesome behaviors, psychiatric complications can occur, anxiety, agitation, depression, and often a form of delusion, a fixed belief, can't talk them out of it, they believe it, that is false. Now often this is called suspiciousness. People with the memory problems that occur in Alzheimer's disease, they're very forgetful. They'll put things down, a purse, or eyeglasses, or car keys, and they forget where they are. And, we all do this, right? It's part of life. But typically, we retrace our steps and find it independently. The Alzheimer patient can't do that. And so what they'll say is, well, our daughter-in-law was over visiting. I think she took my purse. They'll blame others. They'll suspect others. And so this is the moderate stage of the disease. The severe stage of the disease, now they require total care, so at least at the terminal stage. So whereas even in the moderate stage they might help contribute to basic activities such as dressing, now other people are doing those things for them, dressing them, feeding them, bathing them. And at the very end stage, it's no longer simply a disease of mental abilities, but the whole brain seems to be affected. People lose the ability to walk, to speak, to swallow, lose bladder control, bowel, sphincter control. So they're at the very end stage, they're mute, and they are bedridden. And they often die in that terminal stage of not taking in enough nutrition or fluids, or choking because they can't swallow, getting aspiration into the lungs, dying of pneumonia. Now, in the United States, we have 27 Alzheimer's disease centers. Washington University is one. Dr. Carlo Ish is at another at the University of Pennsylvania, that study Alzheimer's disease from a research standpoint. The word has gone out that we think, in order to truly effectively treat the disease, as I mentioned earlier, we have to start early. So the emphasis on research is in that very upper part, the change from healthy to very mild to mild dementia. There is not much formal research in the Alzheimer's disease centers in this moderate to advanced stage. I think a question came up earlier about, do people in the advanced stage still know men versus women? Well, no one has been doing those studies because the emphasis is early on. But I think for the purpose of this symposium, I'll tell you an anecdote about the very first Alzheimer patient, a woman living in Frankfurt, Germany, who was brought to an insane asylum by her husband in 1901. She was very young. She was 51. The psychiatrist at that insane asylum was a man named Alois Alzheimer. And so he interviewed the husband to get the story, and it turned out that for some years before, maybe beginning at age 47, so very early onset, she gradually developed dementia. Now, it wasn't so bad at first, but as it progressed, she was less able to shop at the market, less able to cook. She'd forget ingredients. She neglected the housework, and she'd start to do some of these behavioral problems. She'd get the bedding, instead of washing it, she'd drag it through the streets. So gradually at first, any of you who have had experience with Alzheimer's disease dementia know exactly what I'm going to say. Gradually at first, it's a very, very minimal problem for the husband, but as she progressed and she was less able to do those activities, who took them over? The husband. Because she no longer was able to do that. She also would wander, so he had to keep his eye on her the entire time, and she developed a delusion of spousal infidelity. So as he took over her responsibilities, going to market, talking to shop ladies, she would have fits, screaming, thinking that he was having an affair with those women. And she particularly suspected a neighbor lady, made it so difficult that he no longer could tolerate it, and that's why he brought her to the insane asylum. Back then they had no effective treatments for psychiatric disorders. They housed them in asylums. So that's how she came. The first person with Alzheimer's disease came to medical attention. She died at age 55. Alzheimer got the brain. He's looked under the microscope using new techniques available to him and found the telltale changes, plaques, tangles. We still look for them today. And said, that's a brain change, a process, a pathology that I think is responsible for that woman's dementia. So that's why we named that process for him. He was the first to say that. 1906, he presented this case to a group of psychiatrists. They didn't believe him. Matter of fact, his presentation didn't even make the conference proceedings. It wasn't even published in the proceedings. Just like all of my presentations at conferences. But eventually it came to be recognized for Alzheimer's disease. And in 2006, at the same clinic, it's a small university town in Germany called Tübingen, was the centenary celebration of his presentation. And I was very honored to be invited to come to that very same clinic where Alzheimer presented, and I got to present at that very same setting on Alzheimer's disease. But I learned a little anecdote that I hadn't heard before from a German neurologist who studied the life of Alzheimer, and he gave me an update on that very first patient. So after she died, Alzheimer got her brain, found Alzheimer's disease. Her husband was a widower, and he remarried that neighbor lady. It's a coincidence, but... So now I'd like to show a video clip. It shows individuals in the moderate to advanced stage of the disease. I think you will clearly see from this video that these are persons, and they still can contribute. But you'll also see the effect of Alzheimer's disease, or hear about the effect of Alzheimer's disease on their family members. So I think this is going to work. And I will, after this, will sit down and Dr. Rakel will take over.
Be grateful for the hands. We're going to use our hands today. We're going to use our eyes a lot today because we'll be doing painting, visual art. So for good. Just a moment, cover your eyes just really gently and offer gratitude. From an expressive arts point of view, we're not so much interested in analyzing the works themselves, but really in engaging them in a whole body way in the process of making, and all that involves choosing colors, choosing tools, using the tools. And what amazed me was how long their concentration was, and how involved each of them was in the process of doing it.
I say us. That's just a way of isolating it, but I'm talking about the artists, but I don't consider myself one of them. But you do learn as you go along.
Ken was part of the art exhibit and program that they did at Senior Services. He was never creative, he never painted, he never drew, but now he colors. He loves to draw, and he loves to take the paintbrush now, or he loves to take crayons or pencils and color. And that's something that's brand new with this disease. He drew the exact same design 3 different times. He colored them with the same exact colors, bright, bright colors. He didn't want to stop when the time was up and they said it's time for us to be finished. He kept going. He has a tendency to not know when to stop.
The title of this piece is Magic. This is Magic by Ken.
That pronunciation that comes out, rain tree, but it's the same name. And it is the name of a tree.
And how are you feeling?
It is.
Good. Good.
My husband was diagnosed with the disease in December of 2010, and he had symptoms of it earlier than that, but was misdiagnosed. It took almost a full year for him to be diagnosed.
My dad is 79, and that's okay. We discovered via a phone call from my aunt that he had Alzheimer's and could no longer live by himself. He doesn't remember having children. I'm familiar to him, but he thinks I'm his sister. My brother is familiar, but he thinks that he's his brother instead of his son.
What's the title of your picture?
Tree.
Tree. And how are you feeling after this painting studio?
More like a bush.
More like a bush. So this is Tree.
He has a recurring dream where all he can see is fields of green. And he knows if he steps in the field, his word was malevolent. It's malevolent. I can't go there. And I think that's in his brain, the places where he can't remember anymore. They're empty.
Part of the disease has caused him to have some behavior issues. He taps constantly. He takes his glass at night and sits and taps all night. We walk down the street and he'll look at girls and stare at them and say, "You think she'd have sex with me? Can I stop her and ask her?" He's inappropriate to the point that I try to keep him away from large crowds and public so that they don't hear him saying things like that. He's not the man I married. I wish people could know him the way he used to be.
We laugh, we cry, I get frustrated, I leave the room because I'm angry. You know, you can't bathe him, so you wonder if people think you're a bad caregiver. I mean, it's the whole gamut. The guilt because you can't make him more comfortable. And the happiness when you're sitting at dinner and he's enjoying things and laughing. I mean, it's all over the place.
Frontotemporal dementia is not a common dementia. It's not Alzheimer's. There's no research that is being done to help us that's enough.
I wish if we can't prevent it or we can't cure it, if we could figure out earlier in the cycle that it's coming, and do milestone studies where you can watch people and see what develops and what doesn't develop, and that takes money and that takes people to be a part of it. You can't do that without dollars put towards it.